Hi everyone. Today the presentation will be reviewing growth in infants and toddlers. Now for the purposes of this discussion, we're talking about just growth as opposed to development, and we are focusing on that physical growth. So we'll be reviewing those general principles of growth, discussing key growth parameters, and then identifying growth patterns of infants and toddlers and how to interpret those growth trends. So just a quick review of growth. You can read this definition on your own, but it's just important to note that growth refers to the quantitative physical growth of a person. It's a complex process that's affected by genetic and environmental factors. It's controlled by endocrine and metabolic mechanisms. When we are measuring growth in a child, we are focusing on things like weight, length and height, and head circumference. So why is it important to monitor growth, especially in infants and children? Well, we monitor growth because it is a key element in evaluating a child's nutritional status. It's also an indicator of general health and well-being. It lets us be aware of an absence of disease. But nutrition is the single most important influence on the growth of a child. In the first year of life, from about 0 to 12 months, infants experience one of the most rapid periods of growth in their lifetime. The other period of rapid growth is going to occur during adolescence. So the parameters for growth, as I mentioned, include weight, which is going to be measured in kilograms. We're looking at length or height, and that's going to be measured in centimeters. And the only difference between length and height is whether or not that child can stand. If they can stand and they're vertical, then we're talking about height. If they are still laying and they're recumbent, then we are going to call it length. And then the other thing that we're going to be measuring is head circumference. We usually measure this up to about 36 months of age in centimeters as well. We'll follow up more later in life if there is questionable head size. Okay, these growth parameters are taken at every well child visit. And if the child is in the hospital setting, we would do it at admission and then throughout the admission during specified time frames based on what the infant or child is admitted for. When we check these measurements, it is really imperative that these are done accurately and recorded appropriately. And this is because we want to ensure the child is growing appropriately, but also because medications in pediatrics are weight-based, right? I'm sure you guys are familiar with that. So having that accurate measurement could make a difference between correctly dosing a child or not. Growth, as I mentioned, is very rapid during that first year of life, but even more so in the first 6 months. You should be familiar with the expected gain expectations, but the trends that I tend to see over and over on exams include knowing that that birth weight doubles by 6 months and then triples by 1 year. Infant length, again, is another rapid period of growth during that first 6 months of life. Length growth does happen in spurts instead of slow, gradual patterns. So you'll sometimes hear parents say something like, gosh, I really feel that they grew overnight. And that's because essentially they do. You'll see this growth mainly in the trunks of infants versus their legs, but you can expect them to increase their length by about 50% by their first birthday. This is just some examples of ways that we measure growth. You can see down on the bottom left, we have a baby laying down in a baby scale, and then once that child is big enough to sit, they can sit in that scale as well. It is usually preferential to take a naked weight, but if the child must remain in a diaper, we will always make sure that that diaper is clean and dry and that we have tared out the scale or zeroed it with a diaper on it so that when you put the child on with a diaper, it is already subtracting for the weight of the diaper. Over on the right here, you'll see a little boy who is getting a length, recumbent length, and so they're lining the ankles up with this footboard and then measuring on a paper tape that is on the bed. So growth is very rapid in infancy, but then it slows considerably during toddlerhood, okay? You would expect the birth weight to be quadrupled by 2.5 years, so doubled by 6, tripled by 1, quadrupled by 2.5, okay? Keep repeating that and you can memorize it. Height will increase about 3 inches per year. With toddlers, you are going to start noticing that they're having more of an elongation of their legs now versus their trunks. They're starting to look a little bit more proportional to what we're used to seeing in an older kid. Adult height is actually only about twice that of a 2-year-old height. So sometimes doctors will say things like, hey, you know, your child is this height at 2, so we can approximate they're going to be twice that by the time they're an adult. Once they can stand steadily, we can use a stadiometer, which is over here on the left. You want to make sure that if you're using one of these, the child is standing with their feet flat on the surface or on the ground. We want their back against that vertical surface, and then we want to make sure that the weight is evenly distributed on both feet. They can't be on their tippy toes. They can't be leaning on one side. And you're looking at the occiput, the scapula, and the buttocks and the heels. Those 4 contact points that you can see illustrated by those red arrows in the picture are all touching that vertical surface. And again, these accurate measurements are important for this age group because we're ensuring those growth trends, but also we are still dosing medications. If you have any prescription medications and you're not in the hospital, those are going to be weight-based for children, just like if they were, admitted in an acute care facility. You will notice if you follow a toddler's growth trends that the growth curve is more step-like instead of straight because they have growth spurts that are still occurring during those years. So just a little practice here. You have an infant that weighs 3.5 kilograms at birth, and you're trying to find out what their expected weight will be at their 12-month wellness visit. So I'm going to give you a couple seconds to think about it, to do the math really quickly in your head. 3.5 kilos at birth. I hope that you guys all picked 10.5 kilos. Okay, that would be your tripled birth weight by their 12-month wellness visit. So the head circumference, the last thing that we're going to talk about, is typically equal to the chest circumference by 1 to 2 years of age. Okay, infants are kind of like pumpkins on broomsticks. They have sort of smaller torsos and these big heads, and that starts to even out. Another thing that you want to consider with infants is their anterior and their posterior fontanelle. And so this is an illustration of what that looks like. I want to discuss this here because it comes up a lot in testing. It really does belong in the infant lecture, but since we're talking about head circumference, I wanted to provide a little bit of context for why we monitor that. So when you're memorizing all the milestones for infants, which hopefully you're kind of already expecting to do because there's a lot, and I apologize, but you can't get away from it. Be sure to also remember that posterior fontanelle in the back closes around 6 to 8 weeks, and the anterior fontanelle remains open until about 12 to 18 months. A nice way to remember this if you're not sure which is which is to think about how babies spend time on their backs, and so that back fontanelle will close sooner to help protect the back of their head, whereas once they're standing and they're walking, they can fall forward, and so that's when we're going to see that anterior fontanelle close. Looking at the graphic, you can see why we measure the head circumference until they're 3, right? Until then, the size of the head can be affected by fluid accumulation due to the flexibility of the plates and the fact that there are still openings there that allow the skull to expand. So something like increased intracranial pressure will cause an infant's head to expand, whereas an adult will have neurological signs and symptoms a lot sooner because our skulls have no place for that fluid to escape to. So we will be measuring up until that 3rd year mark if necessary. And then this little picture here on the side just shows somebody palpating that anterior fontanelle. And I highly recommend in the clinical setting that you guys just touch babies' heads as much as possible and feel for those fontanelles. They're kind of spongy and a little bit springy. If a child is sitting up, oftentimes that anterior fontanelle might kind of dip a little bit. It won't be sunk in, but you can feel that it dips down, whereas when they're laying down, it pops up a little bit more. So you can kind of feel how that fluid shift affects how the fontanelles feel. It's really cool. So now that you have this information, how are we going to know if a child is growing appropriately? Well, we need to plot it on a growth grid, and this will allow us to compare measurements of the child over time and then look at their growth patterns and trends. So these are tools that are used to help form the overall clinical impression of a child. We do have 2 different charts. We have the World Health Organization charts for infants and children between 0 to 2. And then those between 2 and 20 years, we use the CDC growth standards for growth charts. So just be aware that there are both. The CDC growth chart usually describes how typical children in the U.S. did grow during a specific time period. And it's important to note that obviously typical growth might not be ideal growth. And then going back to the World Health Organization, that generally describes how healthy infants and young children should grow under optimal environmental and health conditions. So the patterns that they reflect are usually among infants who are mainly breastfed for at least 4 months and still breastfeeding by 1 year of age. So there's a slight nuance there, but nothing that you functionally really need to know the difference about, at least when you're using them in school and for practice. So here's a snapshot of what plotting the weight of a child looks like. So you're going to see on the x-axis you have this child's age in months. On the y-axis you have their weight. They do give them both in kilos and pounds, but we want to use kilos. So let's say, for instance, we're looking this based on the point that's plotted for us, this 12-month-old boy. who weighs 23 pounds, and you're going to chart that dot there on the grid, and then these curved lines that go along the grid indicate what percentile they land on or fall between. So this particular data point falls exactly on the line for the 75th percentile, and they could fall in between, in which case you would just say they're in between the 50th and the 75th. Okay, it's important to know that percentile is not the same as percent. So when we say percentile, what we're saying is that this boy is heavier than 75% of other boys his age, and he is lighter than 25%, or the inverse of other boys his age. And that's sort of how we determine how he measures up. But again, one point in time does not really mean anything because children grow at their own rates. And so it's really important, if we are looking at growth charts, that we're actually looking at the trend of that child and not just a single data point, because it's not really going to give us a whole lot of information. There's another example here. In this case, this is a female who is 30.5 centimeters or inches, in length, and 18 months old, and you can see that she falls on the 10th percentile. And so they do have length for age and weight for age. There's also combined growth charts that have both. There are BMI growth charts. So there's all different types that we can use to get a good clinical picture of a child. And so this is the final slide here, just some things to consider when we're following growth trends. I already talked about most of this. Family history is another thing that we want to take into consideration. Usually, we would question a child's growth if they have really tall parents, but they're pretty short on the growth chart. Or, if they are shorter and the parents are shorter, sometimes it just is reassuring, and it means that maybe they are just a smaller statured child. It's also important to know if there's a family history of a potential condition that could affect their growth. Some red flags or things to be alert for would be a sudden increase or decrease in weight, especially if it's not following the curve, which is, when we put all the little data points for a child on the growth chart, we should see a general curve be created. And if all of a sudden there's a data point that's really low or really high, that might be a red flag for something going on. Same thing if there's no change from a previous steady pattern, and a lack of growth spurts during expected times when they should happen. The other thing is if they are below the 5th or above the 95th percentile. But again, this does require a little bit more context because some children are born early, and a premature child, for example, that was maybe born 8 weeks early is actually going to measure 2 months younger than other children of their chronological age. Now, there are premature growth charts out there to use, but you can also just very easily take an 8-month-old child and just move their plot point over to the 6-month range, and then you can see where they would fall amongst other children that should be more fairly compared to their size. But my daughter, for example, was a 29-weeker, and so she was below the 5th percentile all the time. I think now she's finally in the 12th at 10 years old. And it wasn't a concern for her because she was growing appropriately. She was following her own growth trends. And we knew that, she was 11 weeks early, and that was expected. So just some important things to think about. That is all for this lecture. Hope you guys have a great day.